we're good to get started. We still have still waiting on a couple of committee members, but I'll continue to add them as we go.
Okay. Hi, everybody. Welcome to our first Community Engagement and Communications Committee meeting. I'm Amy Fellows, one of the Universal Health Plan Governance Board members, and I'm the co-chair along with Michelle Glass. And I think, are we going to move to the next slide here? So we're just going to Katie's still letting folks in, and we're going to do a little bit of a tech check that she's going to walk us through. And then we're going to do some introductions. We're going to ask people to introduce themselves, and in doing so, we'll do roll call, and we're going to ask you to please just share with the group, since we're getting to know each other, what motivated you to apply to be on this committee, and then we'll move on with our agenda. It's a long meeting, so take care of yourselves. We do have a break partway through that you'll see as we do the agenda review. So Katie, do you want to do the tech?
Yes, thank you so much, Amy. So welcome everyone. Thank you for joining, and I'm glad you're able to find your way here. Just a couple of quick, for those that may not be familiar, up in the right-hand corner of your screen, you can click View, and you can toggle between Speaker View or Gallery View. Speaker View will let you see who's actively speaking, and then the gallery will show you all of the active participants. At the bottom of your screen, you'll see Unmute and Start Video. If you are able, please start your video. We do have members of the public that they are very welcome to join this meeting, and so any members of the public, though, are not able to connect audio or video. So in that case, by having your video on, it's just easy to tell who's a committee member. And then please stay muted unless you are speaking. And then raise your hand, just click the little raise your hand icon if you do want to speak. And then we also have interpretation available. So we can, if you need Spanish interpretation, you can click on the interpretation link there, and then follow those prompts to select Spanish, and we've got an interpreter on the line available to assist you. So just a couple of tips and tricks. If you have any questions, concerns, or any special needs you need for the meeting, please reach out to me. You all have our email address to get a hold of me, and we can go from there. But thank you on that. And then we will go into introductions.
And I would, can I just add, for those folks who do not need Spanish interpretation, I would encourage you to click English, because then when our Spanish speaking colleagues, when it's interpreted, then you'll hear that. It kind of helps. So if everybody can either select English or Spanish based on how you want to hear the meeting.
Great, thank you for that, Amy. Okay, we're going to just do introductions and roll call. So as Amy mentioned, I will call your name, and then you just have 2 minutes or less to introduce yourself, and then please share with everyone on why you decided to join the committee. So we're going to start with Grace Hokog.
Present, and just wanted to say hello, everybody. My name is Grace Hokog. My pronouns are she, her. And I'm with the Oregon Advocacy Commission's Office. I am a public affairs specialist on the health equity team. I work under House Bill 4052, which declares racism as a public health crisis, and a lot of uplifting community solutions. So I'm happy to be here in community with you all. A bit about why I wanted to join. Some of my background is that I am indigenous to the Pacific Islands in Saipan, and I'm also Mexican. So there's a lot of intersection, especially for Pacific Islanders with health inequities. And I really wanted to uplift that. And I feel it's important to use our voice to uplift everyone, but also just to show, use data to show where the disparities lie in Oregon and to address those. I have an extensive background in public health communication, and I'm really excited to build coalition and I feel community building is all about reciprocity. And so being able to give back to each other and not just be extractive. So I'm excited for the discussions to take place. And because I am on the Oregon Advocacy Commission's office, I understand the behind the scenes and I understand committees are where the work gets done. So I'm excited to get some work done with you all. And thank you so much for allowing me to introduce myself.
Thank you, Grace. Mickey Dirting.
Hi, good morning. I'm Mickey Dirting. I'm from Central Oregon. I also work with Grace. I'm on the Oregon Commission of Asian and Pacific Islander Affairs. I have experience in communications and community engagement in both the private and public sector. And so I thought that maybe I could contribute in that way is bring my skills to the table, as well as bring my equity lens. Thank you.
Thank you, Mickey. We have Juan. I didn't see him join yet. So if he joins later, I'll notate that. Colin Stack.
Hi, my name's Colin Stackhouse, and I live in North Portland, and I've been a member of Healthcare for All Oregon, which is a nonprofit that works towards universal healthcare for Oregon for about 3 years, and almost 4 actually. And the reason that I sort of got interested in this topic in the first place is that I worked for a while at an emergency room here in Portland, and I was like the registrar, so I was non-clinical, and told people every day that they'd have a huge bill. I would tell Medicare patients every day that they might have to pay a lot. I endlessly had to inform people about the financial burden that they would likely face. And it was not fun. So I think that this is what we need to do. So I'm glad to be here.
Thank you, Colin. Max Brown.
Sorry, I was trying to find the mute button there. Thank you all for your patience today. My name is Max Brown. I go with he, him pronouns. And I am a member of SEIU 503. One of the reasons why I put an interest with this is that we've been doing a lot of work with the efforts of universal health coverage, and we have in fact created a standing committee within our union really devoted to those efforts in terms of the work of this committee of engaging with community, building relationships, and also the communication that goes with it, and communicating the importance of this work and how transformative it could be for a possible future here in Oregon. Just really sort of excited me, especially this committee, although it really had a lot of interest in some of the other committees too. This was definitely the top one. Really the privilege to be in the space with you all here today. My day job is with aging and people with disabilities, so I do have a lot of experience working within those networks with our external community partners as well. And I can sort of bring like some human services perspective to the work that we do to hopefully complement a lot of the healthcare expertise that you all bring, as well as community relations. And with Colin, I also reside in North Portland too. And just again, really a pleasure to be here with you all. Thank you.
Thank you, Max. Jensina Hawkins.
Hi there. I'm Jensina Hawkins. I'm based in Eugene. I've worked in healthcare for nearly 20 years, beginning at the front desk of a receptionist at a plastic surgery and dermatology clinic. I've experienced many economic levels from very, very poor to not quite as poor. And my mental comparison always comes back to when I was a military wife about 20 years ago, and I had a baby for $240. I spent $80 for each night that I spent in the hospital. That was the extent of how much I had to pay to have that baby. Since then, 3 kids after that, they've all been in the $5,000 to $8,000 range, and that's with insurance. I recently organized and facilitated Eugene's first citywide healthcare forum in my capacity as vice chair of my local neighborhood association. I'm the chair of Eugene Police Commission. I'm a homeschooled Korean adoptee, married to a Black man, raising 4 biracial children in Oregon. And I want to help make Oregon the best place for our next generation. As our kids grow up, I want them to be able to feel comfortable living here and raising their children here, saying that we have the best healthcare, we have the best access to everything in the country.
Thank you so much, Jensina. Jay Brown.
Hi, good morning. My name is Jay Brown, and I am also in Eugene, so it's so good to see Jensina in here. I currently work at Pearl Buck Center as the Adult and Community Services Director. We support individuals with intellectual and developmental disabilities. I was a foster mom for 7 years, and that came with a lot of limited access due to what their insurance was. I spent 10 years working in mental health, behavioral health, CSEC kids, kind of a wide range. One of the reasons that I did want to start advocating on this particular board was because I've seen it all. I've had lived experience with it. Being in Eugene, the access is so limited, but also seeing that in Coos Bay and seeing that in Drain, like the areas are very hard to get access to anything to be successful in their life. And that's really, really heartbreaking at the same sense as it's such a privilege to say that it's not our problem. So I definitely want to make sure that it comes to light and that we're able to advocate and make sure that people are able to get access to things that they need to be successful in life.
Thank you, Jay. John Buzzard.
John, I think you're muted. Or we can't hear you, but it doesn't look like you're muted.
Can you guys hear me? No? You can hear. Okay, good. So yes, my name is John Buzzard, and I'm based in Corvallis, and I have a twofold motivation for being part of this committee. First, in my professional life, I'm part of a team at Oregon State that's had a pretty some unique opportunities over the past years to engage Oregonians across the state on education, health, and well-being issues. So that's the professional side. On the personal side, I've had some pretty extensive experiences, as others have that have spoken just over the past couple of minutes here, with many facets of the existing healthcare system, from chronic care to elder care and more. And I'm hoping, that combination experience will help me contribute to this committee's work.
Thank you so much, John. Juana Yesenia.
Hello, everyone. This is Juana Yesenia Hernandez. I'm pronouns she, her, and I am with the nonprofit UHPGB. I'm located over here in Malheur County, in between the line between Idaho and Oregon. Here at UHPGB, we help out with like certified assessors, so we help out with people navigate the system to get help to get qualified to apply for the Oregon Health Plan. I'm also a community health worker. And one thing that got me here is got me interested in this, being part of this, is just my passion to help others. As a person who is type 2 diabetic, I've seen the struggle it is to get, medication, things like that. And like I said, I do live in Idaho, so for me, the rules apply very different than it does here. So I kind of see both sides. So I kind of see in any way I can, put anything to help others. I like to do it. So that's what brought me here today. Thank you, guys.
Thank you, Yesenia. Katie Koenig.
Hi there. My name is, can you hear me first? Okay, great. Hi, my name is Katie Koenig. I'm Public Affairs Manager with Oregon Business and Industry. OBI is a statewide association representing businesses from a wide variety of industries from each of Oregon's 36 counties. Our 1,600 member companies, more than 80% of which are small businesses, employ more than 250,000 Oregonians. I'm here to sort of offer a business community perspective. I cover policy issue areas including healthcare, employment, and workforce development. I also serve on the Cost Growth Target Advisory Committee. And I am the mom of 4 boys, one of whom has significant health challenges that he's dealt with over the years. So I also bring that lived perspective as a mom.
Thank you so much. All right, and then Juan Pablo.
Hola, buenos días a todos. Perdón por llegar un poco tarde, lamento mucho no haber estado a tiempo. Me presento. ¿Sí? Hola. Hola.
Yeah, yes, we can hear you. Jorge.
Ok, soy un hombre de edad media, de raíces latinas, represento a la comunidad Latinx. Profesionalmente soy un consejero, soy un trabajador conductual, soy un activista de derechos humanos, represento profesionalmente a Latin X Recovery Center Inc., una organización que provee educación culturalmente específica para profesionales de la salud, además servicios de peer support, housing, entre una gama extensa de servicios. Estoy ubicado en el condado de Washington. Hace 10 años llegué a este hermoso estado, la cual considero mi hogar. Aquí conseguí mi recuperación, conseguí mi misión de vida. La razón por la que decidí postularme para este comité es porque creo que los latinos en recuperación tenemos una visión extensa de la salud, de cómo se ve, cómo impacta en nuestras vidas. Y creo que traer una visión diferente, nueva, puede aportar significativamente a cómo los servicios de salud pueden mejorar con este plan y hacer de este plan el mejor plan de salud de este país. Creo que esa tiene que ser la misión y sin duda abierto a trabajar, a colaborar con todos y a aprender las experiencias de todos.
Thank you so much, Juan. And then lastly, we have Craig Newton.
Let's see, can everyone see me? I apologize. My computer is just taking forever to load. I was panicking. I didn't think I was going to make the meeting. Anyway, hi everyone. I'm Craig Newton. My pronouns are he, him, his. I reside in Medford, Oregon. I'll be very brief. I'm the chairman of the board at Jackson Care Connect, and I'm the co-chairman of the Community Advisory Council for Jackson Care Connect. I've been doing that for about 6 years as the co-chair. And that's it. Hello, everyone. I'm glad to be here.
Thank you. And then we also do have another member named Jocelyn Ogden on the committee, but she did have a previous engagement today and was not able to join. But that's everyone.
Great. And Katie, I co-chair Glass, and I would like to just kind of introduce ourselves and give our why also, so you all can get to know us a little bit. So I'm Amy Fellows. I use she, her pronouns. I'm the executive director of a very small nonprofit called We Can Do Better. Some folks might know it from the past as the Archimedes movement that former Governor Kitzhaber started in 2006 as a way to do healthcare civic engagement and have the public's voice in health system change. So I'm very passionate about that. And I am the parent, my wife for applying to be on the board and then wanting to be co-chair of this committee in particular is I'm through lived experience, have become very active in disability justice. I have a multiracial autistic teenager that lives with a couple of chronic health conditions that it seems many of our neurodivergent youth are also having these chronic health conditions, and we're seeing more and more young folks who are being impacted. And I, in addition to being on the Universal Health Plan Governance Board, am on the Behavioral Health Crisis System Advisory Committee with Juan Pablo.
Estoy en el comité.
Oops. And also the System of Care Advisory Council's Legislative Committee and Lane County System of Care as someone with lived experience. And Co-Chair Glass.
Good morning, everyone, and thank you, Co-Chair Fellows. I'm Michelle Glass. I use she and her pronouns. I'm a member of the Universal Health Plan Governance Board and co-chair of this work group, and so excited to meet all of you. Thank you so much for sharing your why and for applying to do this work. I'm really grateful for all of your expertise and lived experience that you're bringing to this work. I'm also, like many of you, coming to this work with multiple perspectives. One as someone who is the policy and advocacy coordinator for a regional health equity coalition serving Jackson and Josephine counties in the southwest corner of the state. And so have worked as a community organizer and grassroots policy person for the last 15 years in rural Southwest Oregon and seen a lot of disparities and struggles with access to care and a lot of economic impacts from the cost of care as well as barriers for culturally specific services of all kinds in our region, like many of you probably have seen as well. I also was an application assister way back in the Cover Oregon days. So I've seen the limitations of some of the reforms and also the life-saving impact that even minor reforms or relatively small reforms can have, like eliminating the pre-existing conditions barrier to care. I'm the parent of a young person with a significant chronic disease who would not be covered today if it weren't for the Affordable Care Act. So I do want to move the ball forward, and I think we can do so much more because we have made changes in the past that improve people's lives. So I know we can do it. I'm also someone who's had lived experience being an uninsured single mother, unable to access care, and worrying about what would happen if I were to get really ill, like what would happen to my children. So also someone who lives with chronic conditions and struggles to afford care with insurance. So, kind of like many of you, we're all impacted by these systems. And I am so excited to work alongside all of you, as well as our communities across Oregon, to inform a plan that's going to meet people's needs and be responsive. And I will pass it back over to Co-Chair Fellows.
Okay, so just a quick review of our agenda. As you can see here, we're going to talk a little bit about committee administration. We're going to have a review of Senate Bill 1089 and the engagement deliverables particular to that, a review of our work plan, a review of our committee charter, so that you can all get an idea of what the work ahead of us is. And then we're going to have a break, and then we will have a presentation on the Joint Task Force engagement, the process that they did, that the Joint Task Force did in their process, discussion of lessons learned from the Joint Task Force and next steps for the Universal Health Plan Governance Board engagement. And then we will have, we will talk about generating public interest and feedback and end with public comment. Okay, Michelle.
Thanks, Co-Chair Fellows. So we're going to start with the exciting part. We're going to talk a little bit about how we do our work together, just for clarity. So I'm going to walk through a couple of these, and I invite staff, if I miss anything, or my co-chair to please jump in. So starting with committee member agreements, these come from the Universal Governance Plan Board policies and procedures document, which I'm sure you all read. as you were drifting off to sleep, but we're just going to summarize the pieces that relate specifically to this committee's work. Welcome any questions. So we all are here to act in good faith in all aspects of our participation. So we're going to be honest and transparent, and we're not going to do anything that would undermine the work of the board. So expectations are pretty basic, speaking respectfully, efficiently, and not repeating points that have already been made during discussions. We have a lot of work to do and little time to do it in, of course. Listening to all points of view with an open mind and with a goal of understanding. Working towards consensus. And so, we don't want to skip over someone's concern that's being raised, right? So we're going to listen for people who might have a different take on something, and we're going to create time for that. Representing the activities of the board and the positions of others on the board in a fair and balanced manner. So not misrepresenting someone else's comments. Not trying to speak collectively as a committee and not, we each have our own perspectives and other affiliations, but we're really here collectively to do this work. So focusing on that when we're here together. Are there any additional agreements that you all think would be important in order to be able to work together? Yes, Jay.
Just give space, take space. I think it's one of the main ones that should always be in a group like this that is going to have difficult conversations. So give space when needed, take space when needed, and just remember, like, nothing is personal, it's all for a bigger picture. So
Thank you, Jay. Great. Take space, give space and take space, and nothing is personal. Anything else that folks want to add that would make your ability to work in this board, make you feel like we have the guidelines in place to support robust participation and good group process? Yes, Grace.
Yeah, I had a pretty just basic foundational one is just if there are any materials sent out by the Universal Health Plan Governance Board staff, just to read it and be prepared so that we can all have a conversation on the same page, or that we're all speaking about this similar things. And I think that's a good one.
Thank you. Okay. So come to meetings prepared to discuss whatever's been sent out. Perfect. Appreciate that. Anything else? Yes, Jessina.
In terms of community engagement, I think it's important for us all to be aware that the public is watching. As a member of the police commission, I'm always mindful of our meetings being public record and the representation that folks get. And it's hard to get a full picture in just the snippets that they're able to view with us. So I think making sure that we are aware that we're speaking to the entire state, not just to the 12 or 15 of us in this virtual room, I think would be helpful.
Yeah. Thank you for that. And just a note on that, for folks who are here, this meeting, people can join us live and watch as we have these discussions, but these meeting recordings are also posted online. And so to Justina's point, we don't know how many people or who might watch it in the future. So being thoughtful as we discuss these things and trying to create context when we can and avoid things like acronyms, if those types of things. All right, anything else? This is great. Thank you all. Okay, next slide, please. Oh, Craig, sorry.
No, that's what I just thought. This is very, very generic, but just that we all respect each other. Here's what I mean. Like just as long as we're all kind of easygoing. The staff sent us last night a letter, an email from someone, and they apologized. They said this should have been sent 48 hours earlier, and I was fine with it. The point being is just as long as we're all, something may come up for any of us. There may be a medical emergency. Some of us may have to miss a portion of a meeting or something. Just as long as we're all respectful of each other and understanding that we're human and that things do come up. I'm not planning anything, but just trying to, we're all here for the same goal, working together. I don't know if that made sense, but thank you.
Thank you, Craig. Yes, at So Healthy, the Regional Health Equity Coalition I work at, we have a group agreement that's just called Extending Grace. So we try to extend grace to each other. That's what I hear you saying. I see your thumbs up. Okay, great. Thank you for that. I appreciate everyone's participation. Yes, Juan Pablo.
Yo quisiera compartir un breve comentario y es que considero que el momento que nosotros completamos esta aplicación o esta postulación, adquirimos una responsabilidad. Y quiero hacer un énfasis en la palabra responsabilidad, porque de este comité depende el futuro de salud de muchas personas. Siempre ocurren imprevistos en la vida, pero creo que hemos tomado una responsabilidad que tenemos que representar y que tenemos que hacer nuestro mayor esfuerzo para poder expresar nuestro conocimiento, nuestras experiencias en pro de beneficiar a todas las personas de nuestro estado. Así que mi último comentario sería responsabilidad. Creo que estamos tomando una gran responsabilidad, o así lo siento yo, y lo expreso de esta manera y soy empático en que pueden suceder cosas, pero creo que las políticas y las pautas son muy claras.
Thank you, Juan Pablo. Yes. So really keeping front and center who we're doing this work for, and the responsibility that we hold to give it our all. Thank you for that. Appreciate it. All right. Next slide, please. So just a quick reminder of our meeting schedule through the end of the year to some of the points that have been made about, our responsibility to prioritize this and block time if we're able, but also understanding that, life happens sometimes. So make sure these dates are on your calendars, please. November 20th from 12 to 3, December 11th from 12 to 3. And these dates were chosen around the various things that happen at the end of the year. So appreciate everyone's grace and flexibility and responding to scheduling emails. Beginning in January 2025, I believe this slide probably meant to say, meetings will be held the fourth Wednesday of every month from 12 to 3. So if you are someone who wants to schedule ahead, you can go ahead and block those dates. And we'll be reminding it as well as we move into the next year. So process considerations, more fun stuff. So the committee, so we aren't decision makers here, but everyone's viewpoints and participation and input is vital to the work of the board. So we are a recommending body. Everything that happens here will be taken to the Universal Health Plan Governance Board as a recommendation. And so we as a committee don't have the weight, the responsibility, or the authority to make final decisions. So hopefully that's clear. And if you have any questions about that or concerns about that, please let Amy or myself know. This committee will exist until it is dissolved by the board, but I will say I do not know of any intention of the board to dissolve this committee. The board has a very strong commitment to community engagement as a primary priority for the work of the board. We know that we will not be successful, even if we have like the best theoretical plan, without robust community engagement at every stage to shape it and to give feedback and to be transparent too. So know that the board really values this work group and is excited to hear from you all in terms of your recommendations. Finally, committee members serve at the pleasure of the board and by a vote of the board may be removed or replaced. So that's just kind of the legal structure within which this committee situates itself. So we just want to be transparent with all of you that these are this is the way that the committee is set up in relation to the Universal Health Plan Governance Board. Any questions about that? Not seeing any. Great. So in terms of how we will make decisions and move recommendations forward. Oh, Juan Pablo.
Sí, ¿pudiera clarificar exactamente qué criterios utilizan para remover a los miembros y bajo qué estatutos se hacen, si hay algún estatuto? Si hay alguna razón, notificación previa o sencillamente este miembro no va con la visión del plan de salud. ¿Cómo manejan esa política? Quisiera conocer un poco más y creo que todos los miembros también merecemos un poco más de información acerca de este tipo de acciones.
Sure. Thank you, Juan Pablo. So again, I will respond and then I invite staff to clarify if there's anything I miss. I think what this is saying is it's being transparent that the board has the authority to remove committee members if it decides that that is in the best interest of the work and the work plan. Since we're just getting started, we have not run into any scenarios where that would be necessary, of course. But the things that come to mind for me is if someone violated or repeatedly violated our group agreements or undermined acted against the group expectations we went over at the beginning. So like, for example, undermining the work of the board. Misrepresenting other committee members' positions, not being respectful, or an inability to participate. If someone missed a whole bunch of meetings, we would want to replace that person so that we weren't missing a member of this important committee. Does that answer your question?
¿Podría conversar un poco de las políticas de la mesa? ¿Cuáles son esas políticas que tiene la mesa o la junta directiva que han puesto? Si puede hablar un poco más en detalle. Tengo curiosidad de saber cuáles son esas políticas o esas pautas que les gustaría que nosotros siguiéramos.
Could we go back a couple of slides? Right here, perfect. And I believe these, are these slides translated? Yes, okay. So Juan Pablo, these committee member agreements are what I was referring to. So speaking respectfully, efficiently during board meetings, listening to all points of view, representing the activities of the board and the positions of others on the board in a fair and balanced way, and participating in good faith. So these are some of those committee member agreements that I was referring to. And these slides are available in Spanish as well on the website. In addition, the entire
Sí, perfecto.
Universal...
Había visto esta información. Solo tenía esa cierta duda si habían otras políticas, más políticas, que a veces no están plasmadas en las diapositivas, pero ya veo que no, que son unas políticas simples y sencillas de cumplir. Así que muchísimas gracias por clarificar.
Perfect. And in addition, for those who want to go deeper, the entire policies and procedures of the whole Universal Health Plan Governance Board are available to you all in English and Spanish. Not all of them relate to the committee, the work group that we're on, but you are welcome to read those and bring forward any questions that you might have. Staff, did I miss anything? Okay. Can we please move forward? Thank you. So in terms of how we will consider everyone's viewpoint and make decisions together, we are operating with needing to have quorum in order to meet. Hopefully that won't be a problem since there are so many of us here. So again, thank you for your interest and applications and participation. We are working as a working group on a consensus decision-making approach in order to, again, hear from everyone's viewpoint. So we're not going to just try and, go with a majority and not listen to folks who might see things differently. We're going to try to ensure that everyone has the benefit of each person's views, experiences, and backgrounds. So the reasons that you all joined here, we really want to hear from you. So when it comes to voting on our recommendations, we will do a public roll call to make sure that we have quorum, so that we know who was present when this decision was made. We will flexibly follow the processes set forth in Robert's Rules of Order. So we're going to try and balance efficient meetings with good discussion and consensus-based conversation with each other. If there's not something, some really strong reason that a member needs to not vote, we really want everyone's participation when it comes to a vote. So we would ask, you're here for a reason. We want your participation. So we would ask that you, be really thoughtful. If you feel you need to not participate in a vote, make sure that you have a really strong reason for that. Because we want everyone's voices when we're making decisions together. We don't want to miss out on yours. If consensus is not achieved and we have to move something forward, we will use a voting process. And any committee member can make a motion. So if any committee member wants to move something forward as a recommendation, you have the ability to do that. It's not just the chairs, right? If there are votes in the minority, so that means, say, 9 out of 10 people vote yes and 1 person votes no, the person voting no can submit a written explanation of why they voted differently than the rest of the group, and they can provide a different proposal. So that's another way that we can make sure that all viewpoints are included. And so then that alternative proposal would go to the full Universal Health Plan Governance Board in addition to the majority recommendation, so that they would have both to look at and understand. That's a lot of process considerations. How are folks feeling? Is that making sense? Any questions? You want to hear me talk about process more? Probably not.
Can I just ask staff,
Please.
with the number of committee members, what is considered our quorum?
So if every member of the committee is present for a meeting, there are 14 total committee members, which would make your quorum 8.
Okay, thank you.
Great. And on that note, please continue to communicate with staff if you cannot make it for some reason, just so that we know where we stand in terms of quorum. Jensina.
Is quorum the majority of eligible committee members or present committee members?
It's the majority of present committee members.
Craig.
Can Jennifer maybe raise her microphone? I can barely hear her when she responds. Thank you.
Thanks for that feedback. Thanks, Jenny. Grace.
I had a question. So if there isn't forum, is the meeting able to continue in terms of the agenda, but with no voting, or will the meeting in that case be canceled?
I don't know that we have that there's any guidance in our policies and procedures about whether or not the meeting would be canceled. I would say in the absence of policy on that, we would probably move forward with the committee meeting. But Grace, let us have a question put to the board about that and how they'd like to move forward with it, and come back to the committee and clarify. Thanks for that.
Of course, that sounds good, because when there isn't quorum, for example, in the rare occasion at the commission's office, they do still continue with the agenda that was already voted upon, and then they can continue, but they can't make any changes. You can't change what's going to be talked about because you can't vote on it. So that was just that's just some insight that I know, but I know public meeting laws have also changed, so that could also affect that.
Thank you, Grace. And thanks, Jenny. Any other questions about decision-making process or procedures up to this point? All right, I promise the rest of the agenda will be more interesting. I think I am passing this back over to staff. Thank you.
Thanks, Michelle. Can everyone hear me okay now? You can just give me a thumbs up if you can. Great. So hello, everyone. My name is Jenny Donovan. I am the Senior Policy Analyst for the Universal Health Plan Governance Board, so I am staff. I am going to go over a little bit of foundation setting for you all in terms of what the legislation says, what the work plan from the governance board looks like, and what the charter for this committee looks like to give you an idea of what our tasks and deliverables are. So to start out, our foundation comes from Senate Bill 1089, which was passed in 2023. The sections of that bill most applicable to the work this committee will be doing is in section 2, sub 3, F, G, and H, which talk about how the board is going to engage with other entities. These are the required entities that the board must engage with as we go through the process of creating the universal health plan that the board is charged with creating. And so first, the board is charged with evaluating how to work with the 9 federally recognized Indian tribes in Oregon. And a note on that, though this committee will have input in terms of outreach and how we can engage and some strategy on engagement, there will also be a component of government to government relationship work, given that the 9 tribes are of a government. We want to make sure and honor their governmental structures by engaging at the government level and not just at the committee level. So though we will have outreach and we will include this in our communications plans, there will be additional work that's government to government work. And so we'll be evaluating how to work with existing boards, commissions, and councils concerned with healthcare and health insurance. It will be the role of this committee to help identify what those existing boards and commissions and councils are and look at strategies for how to engage with them. We will work collaboratively with partners. If it's okay, I'll go through this and then come back. Is that okay, Craig? Okay. We'll work collaboratively with partners across the complexities of the healthcare system. So we'll be looking at engagement with hospitals, healthcare providers, insurers, and coordinated care organizations to ensure that we're building a sustainable healthcare financing system. A lot of our work will be engaging with these entities around the creation of the finance plan. As we look at the work plan in the next slide, I'll talk a little bit about the interplay among the different committees and where community engagement is really going to come in and play the biggest part. And then finally, we're going to look at engaging with regional organizations to identify strategies to reduce the complexities and administrative burdens of participants in the healthcare workforce and to otherwise address workforce challenges. So we won't be developing the plan on how to fix the workforce challenges, but we will be looking at engaging with members of the workforce and the organizations that employ healthcare workers to understand more about how the plan as it's being developed how the proposed plan would impact those sections. Craig, you had a question or comment?
I'm just curious. I was wondering if anybody on this committee was representing any of the tribes in Oregon. Thank you.
Thanks for that, Craig. Not on this committee. We don't have any tribal members representing a tribe on this committee. I am not sure if we have members representing tribes on any of the other committees. We will have tribal members who are on committees, but not specifically representing their governmental organization of the committees. Any other questions about this part of engagement and sort of what I've laid out here? I'll continue to clarify what we're talking about. Jay, go ahead.
Hi, yeah, I'm actively looking at SB 1089 and I'm not seeing what you're seeing. Like I am not seeing what you're seeing.
So are you looking at a printed version or online?
I'm looking at the one that's on the website.
Okay, on the website. Okay, so if you go to section 2, which is far down, that first talks about single payer healthcare financing system and defines it. If you go a little further down, you're going to see 3 in parentheses and developing the comprehensive plan.
Oh, there it is. Okay.
Okay. And then follow the little letters down and you'll get to our F, G, and H.
There it is. Perfect. Thank you so much.
Absolutely. Any other questions about this slide or the bill? Okay, go ahead to the next slide. So I think that during orientation, the general committee orientation, you did a little bit of oversight look at what the work plan looked like. I wanted to include this here again, just to give an idea of what the interplay between the different committees and the board kind of looks like. So the work plan timeline for the second phase, the first phase of the work plan was foundation setting for the board. And so as we move into this current phase, you see that community engagements work stream starts at the beginning and goes all the way through to mid-March of 2026. Under that, communication starts a little bit later after this committee has come on and starts developing some strategies, and also goes through to March of 2026. And then we start looking at the committees that are going to be creating the actual proposals. So Finance and Revenue had its first meeting last week, I believe. And the way that the board structured the work plan is that the Finance and Revenue Committee will start to look at where and how this plan, what the plan is going to be, will ultimately be financed. Shortly after Finance and Revenue started its work, the Plan Design Committee will be starting its work. I believe their first meeting is November 7th. And so they'll be coming in and looking at what the benefits, what the structure, what the payment structures, what the plan will also look like. There is going to be a lot of interplay between those two committees, going back and forth to say, this is what we think in terms of the number that we have for financing the universal health plan is going to look like. And here's the plan design. This is what we want to include the plan. What does that look like in terms of cost? Does it cost more? Does it cost less? Can we add more? Do we have to look at taking away something? And so those two committees will be working really closely. As the Community Engagement Committee, there are going to be due points where those committees come up with proposals that are taken before the board, and the board says, we like it, go find out more. At that stage, when they say, go find out more, that proposal will come to the Community Engagement and Communications Committee for us to take and create questions, to create information, one-pagers, communication, to then go out and engage with some of the entities that I talked about on the last slide, to go out and get feedback about the plan as it's being created in real time, to ensure that at every stage of creation of the plan, we're getting feedback from the community. And in this case, the larger part of what we say when we define community here is really the healthcare industry, is really business, is really looking at the general public from a healthcare consumer point of view. And so this isn't going to be really general public engagement. It's not going to be listening sessions, which we'll hear a lot about later when Devlin comes from OHA to talk about the work that the Joint Task Force did. This is really going to be targeted engagement to get feedback on the plan as it's being developed. Once we get a little bit more of that feedback, and once some of the proposals begin to solidify and the board says, yes, I think this is what we want to move forward with, those proposals will go to the Operations Committee. The Operations Committee is going to start a little bit later. We don't start until December. And we'll start to look at how do we operationalize this plan? And then it'll be our job again to go out and say, here's the plan that's being developed by the Universal Health Plan Governance Board. Here's how we intend on operating it and delivering it. What's the community have to say about this? And again, we're talking about those entities in the healthcare industry, in small and large business, and in healthcare consumers who we're going to be targeting to get that feedback from. And then hopefully we'll have all of this wrapped up sometime at the beginning of March of 2026, and we'll really start to look for feedback on the final plan as we write the final report that will go to the legislature with the plan. Katie, you can go to the next slide, but does anyone have questions, feedback, comments about that? Colin, go ahead. Oh, I think I saw you.
Yeah, I did.
Oh.
So our work as this communications committee, looking at this chart, it looks like it will end in March 2026, and then there's still about 6 months of the governance board doing their work. So we won't be in this group after March 2026, and there'll be that 6-month period of formation of the final plan. Is that right?
To some degree, during that last 6 months plan, what will be happening, hopefully, is that we will be writing up that final recommendation to the legislature. There could be need to go back and say, can the finance committee look at this one thing again? And can community engagement go out and take another look? There's always the possibility that there will be need for more community engagement, and we will be communicating throughout this phase to try to get more information out to the public that the plan has been designed and will be submitted to the legislature to ensure that people keep watching, so that when the plan is submitted, everyone is on board and realizes that the plan is being submitted at this point to the legislature. And it is right before the 2027 long session. And so there probably won't be a need for a monthly meeting at that point, but there still could be work for this committee to be doing. Anyone else? Jensina.
How is it that our committee is separated into 2 work streams?
So that's primarily because the community engagement part of the work stream and of our committee is very much based in the bill. It's very much based in required community engagement that needs to happen based on SB 1089. The communications part of it is something that's a natural, I would say, offshoot of community engagement anyway. But it was also really important to the board, as the work streams were being designed, that there was dedicated communications, a dedicated communications plan. And so this group will be looking at not just who should we be engaging with, how do we ensure that we have a strategic plan to engage with all of those entities, but also how are we communicating the plan? What is our plan for communication? What is what's in the one-pagers that we want to send out? How do we ensure that we're communicating in plain language? How are we reviewing things that we want to communicate out to the general public and ensure that those are really capturing what the work of the plan is and highlighting how the community can be involved and ensuring that it's something that is understandable by any person who picks up any communication from the Universal Health Plan Governance Board. Does that make sense? Do you have a follow-up? Okay. Oh, Amy.
I don't know if I'm anticipating the follow-up, and I don't want to, I know you have it later, but just, I don't know, it might be helpful to either reference the consultants and other folks that it's not just this body creating all the communications, that we have support and
thanks,
you know, that part of it, because otherwise the 2 streams might feel overwhelming.
And that's a great point. And thank you for bringing that up. So we, all of the work streams for the board are going to be supported by outside contractors for the most part to help us with this work. So the community engagement committee, we are currently working to bring on a contractor to help us. She did a little, her name's Diana Bianco. She did a little bit of work with the task force in terms of reaching out to some of the business entities. She has a long relationship with small business, large business, and the healthcare community, and a background in healthcare. And so she'll be helping us, and we believe she's going to be coming on probably in December to help us with our strategic planning around what our community engagement plan is going to look like. Once we have a better idea of what that plan will look like, and the committee has provided input there, and we've sort of figured out what we want it to look like going forward over the next year and a few months. We'll be working with, I haven't mentioned that the Universal Health Plan Governance Board is housed within the Department of Consumer and Business Services. It's a state agency. The Universal Health Plan is its own entity, But as staff, we're actually employed by the Department of Consumer and Business Services, and they sort of run all of our back-end operations. Their communications office is going to be helping support us in putting together communications, making some of our communications look flashy. They'll be our back-end communications team. If it comes to the point where we feel like we need additional communication support outside of what they can provide, we can look into further contracting for a communications firm to help us with that work at this point. But once we have our plan put together with Diana's help, we'll have a better understanding of what we're going to need for our communications plan. Thank you so much for that, Amy. It did seem very overwhelming. Anyone else? Craig, go ahead.
What was is it Deanna?
Diana.
Diana. What was Diana's last name?
Bianco. Wait, no, I'm sorry. Yes, that's correct.
I think I worked with her before. If it's the same lady that I'm thinking of, she's excellent, everyone. I worked on the Kroger Albertsons Community Review Board, and we were tasked for just a recommendation how that proposed merger would affect pharmacies. And she facilitated all the meetings. If it's the same person, she's excellent. She is a great person. Anyway, thank you.
And she comes to us from Artemis Consulting, if you all want to look her up. And she came to us highly recommended from both the Legislative Policy and Research Office, who were staffing the task force on universal healthcare, and some of the other healthcare professionals and industry representatives that we've spoken to. So she has an exceptional reputation within the field. Thanks for that, Craig. Anyone else? Okay, Katie, go ahead to the next slide. And so talking about the work streams, so you can see community engagement and communications is work streams 1 and 2. It was important to the board, and it was a decision of the board that community engagement and communications be first and second, because they were divided into 2 work streams. But it, as Michelle mentioned, it is the absolute conviction of the board that everything that the board does be completely transparent and that it be communicated out, because there is a full understanding on the board that whatever is created here can only continue and can only be passed, can only be, created with the support of the community. And so that was work stream 1 and 2. Here in the work plan, it shows you that finance and revenue would start next, then plan, design, and expenditures, operations, and the transition and implementation committee has not been recruited for yet or put together. It was decided as the board was creating their work streams and their work plan to separate out transition and implementation from operations. And at the time we were already recruiting, so we didn't recruit separately for that committee yet. And we'll be looking at, once we move into the operations committee starting to do their work, when it would be a good time for the transition and implementation committee to come online and start evaluating what's coming from finance and revenue, plan design, and operations to look at what that transition plan is going to need to look like. And they'll come online much later than all of the other committees as sort of the final piece to look at how to take the entire plan and the operations plan that's put together for it and actually transition from the current system into this new system. You can go ahead to the next slide. So after the work plan was created by the governance board, the governance board decided on, okay, we have all of these work streams. There will be a committee to support each of these work streams. And so each committee had a charter put together. As with both work streams, as with community engagement and communications having 2 work streams, there are also 2 charters that lay out the tasks and deliverables for each work stream. So for community engagement, the tasks that are set forward are to review the joint task force's final report, appendices on community engagement, and understand the feedback that communities have already given, and for us to look at and identify the gaps in engagement. There was very specific targeted engagement done by the joint task force, but there wasn't a good deal of engagement done specifically on behavioral health consumers and providers. And to communities with individuals living with disabilities. And so those are going to be two things that we're going to want to look at and determine how to ensure that we're actually creating focus there. As I mentioned earlier, Devlin Prince from OHA will be joining us during the second half of the committee to do a presentation on the Joint Task Force. Devlin is an employee at OHA, but was a representative from OHA on the task force during their community engagement. And so he has a real wealth of information about what they did there and what they heard. Second will be identifying strategies to engage with communities and stakeholders using existing structures and meetings. And so this is what I alluded to earlier. We really want to take the expertise of this committee and the individuals within this committee and say what's already out there that we can tap into. Who are the organizations, the community-based organizations, the boards, commissions, what already exists that this committee can tap into and go out and get the information and feedback that we're going to be looking for as we move into the proposals for the plan design. We're going to engage with key partners, including the tribes, businesses, providers, clinics, CCOs, community-based organizations, disability-led organizations, and insurance carriers. And so, like I said earlier, this is really targeted engagement. We really need to go out and look at different organizations, institutions, and employers really, and large and small business to get their feedback on the plan as it's being created, so that the board can make adjustments where they can to understand where there might be tension points. That's really going to be the point of this committee, is to really go out there and get that information to bring back to the board and provide them with that sort of perspective as the plan is being developed. We're going to develop a plan for general public outreach to engage throughout the finance and operations committees. Those two committees are really going to be the points where, when they create a proposal, it's going to be us on high alert to go out and get that feedback and bring it back to the board so that they can continue moving forward, but continue moving forward with that engagement and feedback so that any changes that need to be made to the plan or to the proposals can be put into the plan and then vetted, whether it's through an economic analysis, an actuarial analysis. We're really going to be bringing back that information that allows them to tweak the plans and then have it go back for further analysis. We want to engage with small and large businesses, particularly in the development of the revenue and finance. Development's choice of the Universal Health Plan. So those revenue and finance plans that the Finance Committee will be looking at most likely will involve a lot of really identifying and analyzing different taxes. It's incredibly likely, but not certain, that if this were to be funded, it would be funded from some new tax base or existing tax base. But it'll be our responsibility to go out to businesses and have those conversations about, this is the proposal that's coming from finance. What is your feedback? How would this affect you? How would this affect a very large business? How would this affect a very small business? To ensure that we're engaging there and bringing that information back to the committee as they create their proposals. And then finally, to present feedback received through community engagement efforts to the governance board. Those are our tasks. What we have to deliver is using existing mechanisms to get feedback and identify gaps, community engagement outreach plans for business, healthcare industry, and healthcare consumers throughout Oregon. And as I mentioned, and Amy prompted, we'll have some assistance in that from Artemis Consulting to help us put together that engagement plan and ensure that we're really meeting all of the requirements of all of the entities that we need to be providing outreach to and getting that feedback from. And at a minimum, we'll present workstream recommendations to relevant community partners following each workstream to get feedback on recommendations prior to board review. That's final board review. So that was a lot. Does anyone have questions, concerns, any sort of comment or feedback? Michelle?
I just want to, as an action-oriented person, I just want to connect these tasks and deliverables to the second half of our agenda today after the break. For folks who might be feeling a little antsy, we're trying to make sure you have all the foundational information needed to feel like you can really fully participate here in this committee. But just to kind of make this concrete, we will be starting the first bullet point, review joint task force final reports, community engagement activities. We'll be doing that today with Devlin's presentation. So during that presentation, just know that afterwards, the last 2 agenda items before public comment are going to be taking what Devlin shares with us about what the task force targeted engagement looked like and thinking about what were the gaps, what do we need to build on, and where are some opportunities to start doing that. So just know that the second half of the agenda, we are going to move into action. So this is really to prep you for that. So I just wanted to create that context. Thanks.
Juan Pablo?
Sí, tengo una quizás sugerencia y algo que me llama poderosamente la atención es cómo este plan va a impactar a nivel de los impuestos a todos los beneficiarios, tanto a la población en general como a las empresas. Y me pregunto si cuando toquemos ese tema sería muy beneficioso para todos si pudiésemos traer un experto que nos explicara cómo va a impactar en las finanzas de las poblaciones más desfavorecidas estos impuestos y cómo va a impactar en la población en general. Es una de mis mayores dudas y preocupaciones, porque creo que por ahí pasa también el éxito del programa.
Thanks for that question, Juan Pablo. I do not think I am qualified to answer that question. I think that it really is the crux of what the Finance and Revenue Committee is going to be looking at, is what would be the effect of a variety of different types of taxes, looking at each one of them individually. How would that impact large and small business? How would it impact community members? How would it impact low-income individuals? So that's really going to be the work that they're going to be focusing on, and that we will be going out and trying to get feedback on as we look at, okay, financially, we see through numbers what this impact looks like. It will be the responsibility of this group to go out and actually speak to these businesses and individuals to say, what does this actually look like as an impact to you? I highly recommend that you, as much as possible, I know it's a time commitment, follow the work of the Finance and Revenue Committee and any materials that they produce. There will be notes and summaries produced after every meeting, and feel free as a community member to provide feedback to them through their public comment process. And as we're collecting information, ensuring that we bring that perspective also, that it's being fed back to the board in terms of what the feedback we're hearing from the community as we do our work. Colin?
Gracias por su clarificación y valoro
I'm
mucho
sorry.
su honestidad.
Absolutely.
While I've been asking or chatting with people about the work of the governance board, this question has come up for me, and a way that I have been able to respond is say that the finance committee is doing this work, and basically we can't give a firm answer, but if there was the firmest possible answer, looking at the work of the Joint Task Force on Universal Healthcare, my interpretation was that they think it would basically be the new taxes would be more or less comparable to what people are paying currently to their insurance companies. Is that an accurate reflection of what the task force found? And is it fine to add that on in addition to saying we don't know the exact answer yet?
I think always reflecting back what the task force, they didn't provide a final recommendation on financing. What they found was some equation in terms of what current costs would be and what the tax need would be. I do want to point out, just as a matter of administration for the board and for the committees on that point too, is it's very important when speaking outside of your committee or outside of interactions with the board to ensure that you're not representing the full committee or the full board, but as you understand it as an individual. And I think that absolutely what the way that you're understanding it, Colin, is certainly the way that we've been discussing it and how the task force or what the task force came to. And I'm sorry, Amy, you had your hand up, and please feel free to just.
Oh, I just based on the questions, I was wondering, and I think you'll get to it more, but kind of the feedback loop between, so like, and you have talked about it a little bit, but you know, as the finance committee creates something, and then we will get presentations on that here in our meetings so that we're able to speak to it, and those kind of feedback loops between the various committees, and especially that they all come through here because then we have to be able to communicate about it.
Yes. Yeah, that's a really great point, in that as the communications and community engagement committee, we will be getting presentations from other committees on the proposals that the board is willing to move forward. And the board discussed during its last meeting a little bit started the discussion of what the decision process would look like. And there was tangential agreement that essentially what will happen is a committee will take on a component of the plan. They'll look at that, they'll go to the board and say, this is what we're looking at. This is the avenue that we're going to go down with this proposal. And the board will say, we don't like that, go find something else. Or we think that that's a great idea. Please move forward with community engagement and with more analysis of that idea. At that point, the committee would come to us and give us the information so that we would understand what we need to go out and communicate. And then after that communication is done, it would be the responsibility of our committee, and with the help of our consultants and with staff, to put together what we've heard after that engagement. We would do the engagement, and then as a committee talk about what we heard and what should be communicated back to the board, what should be highlighted, what really needs to be the points that we bring to the board in terms of what we heard from that feedback. And we'll be taking that back to the committee, also the committee that was making the proposal, for them to make any adjustments to the proposal that they had, so that it can all go back to the board for the board to then again review and say, thank you, this is great, we would love to move forward with this, or we're not really happy with this, maybe based on community input, that they don't like the changes that were made. Any reason that the board wants, they can send it back to the committee to do further work on the proposal, or send it back and say, that didn't turn out the way that we thought it would, we want you to come up with a different idea. And so there's going to be a continuous sort of feedback loop going from board to, or from committee to board, to other committees, and then back to the board, and then out to the community, and then back to the committees, back to the board, and then possibly back to committees again. And so there'll be consistent communication among all of the committees and board as we work through the process. Any other questions about where we are right now? Craig.
This is kind of a question / comment. I worry about when I look at bullet point 3, engage with key partners, including, and the last one, insurance carriers. And I know I'm getting way out ahead of myself. I know that, but I'm just worried how we're going to communicate to them. Hey, your business may be reduced by 75%, and I don't know how we're going to get them aboard to buy into the plan. But I'm just one person and not an expert. But I worry they're going to be a dam in the river to stop us from moving forward. Thank you.
I think it's great feedback, Craig. And one of the reasons that we wanted to bring in Diana Bianco is because she has such a wealth of expertise and experience working in the healthcare community with healthcare insurers, with healthcare providers. So hopefully we can, through her contacts, try to engage there, and really as a committee work to try to find innovative ways to bring different groups on to give us the feedback. But I think that your point is well taken. We're only going to be able to engage with the people who are willing to engage with us. And hopefully that will be everyone. And hopefully we can get all of those perspectives. That'll be our goal in the work that we're trying to do. Okay, Katie, do you want to go to the next slide? And so this is the communications committee, or I'm sorry, the communications tasks and deliverables for the committee charter. And so the tasks there are to identify communications materials needed and develop strategies for using those materials, and identify the best messages to communicate the value of the Universal Health Plan. And as I mentioned, as of right now, we're going to be working with the Department of Consumer and Business Services. I might occasionally refer to them as DCBS. I'll try to say the whole name, but if I say their acronym, please excuse me and know that that's what I'm talking about, but I'll try to stay away from that. We'll be working with their internal communications office to produce these materials as the committee agrees upon what the messaging should be and what we'd like to send out. And those materials will come back to us for review and discussion. If at some point we feel like we need to bring on an additional consultant, or the communications department within the agency tells us, you know, the Universal Health Plan is really asking for a lot, we'll work together to see if we can get additional support there. But for right now, we really do believe that the internal communications office is going to be able to support us really well. And our deliverables will be to develop a communications plan, including messaging strategy that includes materials developed at major benchmarks of the project available for outreach and community engagement. So those materials that can effectively summarize the proposals coming from other committees in plain language, ensuring that the community can really engage with our materials and our messaging, and that it's not confusing, and that we're presenting really very complex ideas in the simplest form that we can. And a minimum of 10 presentations of the comprehensive plan to finance and administer the Universal Health Plan to communities throughout Oregon to hear the final work prior to submission to the legislature. And that's that period in 2026 that we were looking at on the work plan timeline. So once the full plan has been put together, once it's gone through operations and transitions, this committee will still have the work ahead of it to really put together a communication on what that plan is, again, in the simplest language, to ensure that as many people as possible can engage with it very easily and get those presentations and those materials out to the community. And finally, to create that dissemination plan for the final report to ensure the public has full knowledge of what's in the report when it does go to the legislature. And so questions, comments there? No, doesn't look like it. And I think this is the last slide before our break. So Devlin Prince from OHA is, oh, Craig, I think you had your hand up.
Well, I'm sorry. Yeah, I was writing notes.
No.
Real quickly on the 10 presentations, because this, how are we going to do that? Is it face to face? In other words, you know, throughout the state, how are we going to? It'd be easier to do it online, but people may not like that. How would you be able to repeat the same thing in Southern Oregon, Western Oregon, Eastern Oregon, Portland area? What would these 10 presentations look like? Do you know, or is that too early of a question to ask? Thank you.
Well, a lot of that is going to be a decision of this committee as to what those 10 presentations are going to look like, and whether or not they'll be virtual or in person. There is some discussion at this point as to whether or not the board may be able to do some traveling meetings where the board would be going out into different regions of the state to have a board meeting, and following those meetings up with community and community engagement opportunities where we're engaging with both, say, insurance providers, healthcare providers, CCOs, and having community engagement forums as we're doing those traveling meetings. So that might be an opportunity that comes before us, but really it's going to be the work of this committee to make that determination and to make sort of that plan as to, with support from staff, with support from consultants, with support from communications professionals, not just all on your own, but to really come up with what the ideas are going to be behind that, really relying on the expertise of the members of this committee and the work that you've done and your regional diversity to help inform the committee as to where these events need to be held, who needs to be invited, will this community not come if it's virtual, or would it be much easier if it's virtual? Those kind of decisions, and make that plan to take to the board and recommend to the board how it should be carried out. Anyone else? Grace.
Yes, I have a two-part question. One, are committee members, as the plan develops, are committee members expected to travel to small engagements as it pertains and is relevant to the plan, are committee members expected to do that? And secondly, if they are expected to do that, are there any travel expense detail things that we have to log? And I know it's a little bit ahead, but I was just curious about that.
No, it's a great question. At this point, there's no plan. So we'll be creating that as we move forward, and whether or not committee members would be engaging, maybe if it's in their region. There is built into the bill, there is the ability to reimburse committee members for travel expenses. And so that would be an option if we did have some sort of traveling request or need for committee members.
That's good to know. I know a lot of the work can definitely get done over email, so trying to make mountains move through that, but there are definitely some engagements that would definitely benefit from being in person. For example, culturally specific communities, sometimes they don't want to talk about things over virtual meetings, or a meeting in person feels a lot more personable to them and willing to share. But it's good to know that there is some travel expense details. I know it might be a bit limited, a few thousand, but hopefully it'll take us the long way. But thanks for answering.
Thanks, Grace. That's a great point. Anyone else? Okay, so it looks like that takes us to break time. We will reconvene at 1:40. It's 1:28 now, so we've got about 12 minutes. We'll reconvene at 1:40, and we'll have Devlin with us to give us a presentation on the Joint Task Force. So thank you all. Take a minute, take a deep breath. Thanks for engaging so far.
Okay, it is 1:40, so we'll be getting started in just a moment.
If committee members, as you come back, could maybe turn your screen on so that we know that you're back, and we're going to get started with Devlin Prince from OHA's presentation about the task force engagement.
Hi, everyone. Can you hear me all right?
Yep.
Great. So I am Devlin Prince, he, him. I'm work at Oregon Health Authority in the Office of Health Policy. I was a staff member for the Joint Task Force and Bill 770's work, and I got to help out a lot on the community engagement piece. So I will be taking you through what we did and some lessons learned from my perspective, and then answer any questions. Next slide. So I thought this was really interesting. I wanted to make sure I put this in here. The task force.
We aren't seeing a screen, just FYI.
Oh, just.
I'm seeing it. Maybe at the very top of the Zoom, click the screen option rather than meeting.
Thank you. I don't know how I got clicked on that other one.
No problem.
Awesome. So this was the definition of what the task force meant when they said we're doing public engagement. And they wanted to refer to the process of soliciting public input. And that's engagement from community, employers, and healthcare organizations. And I think this is really important for you all as well, being very clear on what you mean by public engagement or on community engagement. And it really helps set the stage so community members and everyone you're getting information from knows how to approach any situation you bring to them. Next slide. So the phased approach that the task force did for public engagement was mostly around plan design, and it was started with roundtables, community listening sessions, and special interest forums. Those kind of three parts. There's professional facilitation done by Lara Media Services and Diana Bianco, and that helped with a neutral presentation of the plan design. And the facilitators are very skilled and were amazing and were able to get really good discussion from people who came. The goal, again, was to get a plurality of perspectives among the participants. So not all input will support or align with the plan proposal, but the idea was to also make sure we could hear where it was in alignment and not in alignment. And then an analysis was done to find out how well the plan that was created by the task force fit or did not fit in with what we were hearing from community members. Next slide. So as I said, we were wanting to solicit information from community, employers, and healthcare sector. So the community, we did 7 demographically specific roundtables, and that was in February of 2022. And then later on did 6 geographically specific community sessions in June. For employers, we did virtual forums to get feedback on the financial plan and focused outreach to large and small employers and unions. And then finally, for healthcare providers, also did virtual forums to solicit feedback, and the focus was on from providers, insurers or payers, and hospital systems. And I'll take you through each of these that we did. So first were the phase 1 roundtables. These were, we did very focused, specific meetings with groups of Spanish-speaking individuals. African Americans living in Oregon, American Indian Alaska Native, Pacific Islanders, individuals with disabilities, individuals with behavioral health needs, and rural Oregonians. And what was the point of these ones was to really make sure we got to a lot of the groups that have historically been marginalized or left out of being part of the policy process. The idea also was to take this information and then build. This was done before the plan design had fully been completed for the task force. Next stage. Next slide. So in phase one for community engagement, what we heard and then how they were able to get the plan design considerations. So from those 7 community groups, they gave input such as in affordability, they wanted to make sure that people pay based on what they can afford. So then the design consideration that the task force did was they wanted to have progressive or means tested contributions for high income employees. In revenue structure, we heard from groups that they want a tax is not progressive if it applies to everyone. So instead, their design consideration for the plan design was around structure taxes to minimize burden on low income folks, and no sales tax was heard loud and clear. And then for system costs, community input was around avoiding increasing any taxes, and the design considerations were to examine cost drivers to reduce overall costs. So this is kind of an example of what the task force did when they took the information, and then what were the considerations they used in order to make the plan design. So phase 2 happened a few months later, and to also put in perspective where the task force was, the final report was due in September. So June, July, and August were kind of rushed in order to get as much public engagement as possible, and we were able to accomplish that. Next slide. They created goals. The task force wanted to create goals for the summer when they were soliciting feedback, and it was shared also, these were shared with community members and those coming to the virtual forums. So it was to remind the public of the task force charge, share preliminary proposal, which is the plan design. They wanted to build more trust in the task force process, and along with receiving community feedback on any specific issues. And they also, if there was a way to design a plan to improve the health of families and communities, and authentic space for public to learn, react, and ask questions. Next slide. So the regional community sessions that we did, these were all held virtually. We sent out invites and flyers to about, I think it was about 120 to 140 community building organizations and nonprofits throughout the state, and asked them to share those widely. We had it split coastal region, central, eastern, southern, the Portland metro area, and Willamette Valley. All of these listening sessions were held during the weekday evenings or on weekends. We did both, and they were 2-hour facilitated discussions led by Laura Media Services, and they were all held over Zoom. I will add, we also had larger statewide Spanish-speaking sessions for anybody who's a Spanish speaker in the state who wanted to also hear this. And Laura Media Service was able to help with translations. So the specialty forums, in order to solicit feedback specifically from providers and special interest groups, such as healthcare industry, we had 6 of those, and shared mostly more about the financial plan and wanting to understand provider participation. So these were also 2-hour sessions. Diana Bianco helped out with these. They were all held virtually as well. And we had providers, payers, and hospitals, and then large employers, small employers, and unions. This is an overview of the analysis that we did. So we took all of that feedback and we looked at where it aligned with the with the design and where it didn't align. And these are a way for the task force members to see what kind of considerations they took and how they fell and how the community was taking what they had. And next slide. And then I shared some lessons learned, but would love to really just talk with you all about these. You know, the remote options allowed for a lot of outreach across the state, which was amazing. And also having it on weekends, evenings, and just being aware of schools and holiday schedules. This was really to make sure we get at members who, a lot of people who may not have the flexibility in their day to come in the middle of the day to a session. The short timeline for all of this really only allowed for one-time input. So we, you know, community members came, providers came, they told us, you know, how they felt and what they took from our plan, but then there wasn't really iterative. And so public engagement, you know, would have been nice to be able to do more robust outreach and more communication and conversation with people. We had plain language specialists review some of our materials, and that was very, very important and useful when we're talking. And I'm sure even some of the words I've used just now doesn't sound the same or land on the ears of everyone that hears it. And so it's really important that we're using plain language when possible. And then finally, again, third-party facilitators' expertise was it was a game changer for us, and learned a lot about how to facilitate, also allowing people to direct their questions at someone, or, you know, not just at the state or at you all or task force or on the board. That's a link to the task force webpage, which has the recordings of the community sessions. So you can go back and you can see those and how people were kind of questions they were asking and how they were involved. So I think it's questions, right? And I apologize for going so quickly through that, but
Really quickly, Devlin, just make sure that you press under interpretation, select the English channel if you haven't yet. Down at the bottom of the bottom ribbon.
Thank you.
Mm-hmm.
Should I call in people, or
I can help. Or I think it was Craig and then Mickey, and then I also a couple screens back there were a couple of acronyms that I don't know if everybody in the group knows. I noticed the social determinants of health is the SDOH. So I just wanted to just make sure that everybody knew what those were too.
Absolutely. And I can, so social determinants of health, and then ERISA, ERISA. I can never remember completely what it stands for. If anybody.
Employee Retirement Income Security Act. It's a federal law that talks about benefits that employers can offer.
Thank you, Danielle.
And then why don't we go ahead with Craig and then Mickey with questions or comments?
All right, thank you. Hi, Devlin. Thank you for that presentation. I forgive me if I missed it. I didn't see numbers of attendees. So my question is, I don't need to know exact numbers, but would you say the turnout was good, bad, average, or were you happy with the people that showed up? Thank you.
Yeah, absolutely. And thanks for that question. We had over 200 individuals across all of the sessions, which, you know, for us was really exciting. You know, we only really had 2 months to do all of this and to get word out. And so we were very happy with the turnout. And that was, you know, and it was pretty even across all of the different regional community listening sessions. Obviously, the Portland metro area had the highest number of people that were able to come. And then for the specialty interest forums with the hospitals and providers, that one was a relatively small group in general for each of those. We had, I want to say maybe 8 to 10 people for each of the smaller ones.
Mickey?
Hi there. A couple of questions. I was wondering, the first one is, for the historically marginalized groups, did you, after you went through the process, were there groups that you were thinking like, oh my gosh, I wish we would have included, for example, like LGBTQIA2+ or 2S+, And then the second question I have is, now that it's over, is there anything that you're looking back on and thinking, oh gosh, if I had, it to do it over again, this is what I would put in because we were missing that, or lessons learned?
Yeah, absolutely. And so for the first question, absolutely. There were definitely groups, LGBTQ plus folks for sure. I also wish that there was more of just older adults in the state that we could have been more focused on. Uh, and even for, within the disability community, there's different groups that we could have done within there. So that was discussed. We were limited by time and resources as well, and that's always an issue. And then the thing that I would say that really stood out that I wish, and I said this a little bit, but I really wish we could have been able to do more of coming back to community members, sharing what we heard from them and what we changed or didn't change, hearing again, and really making sure that we had a conversation going back and forth. Again, timing is tough. And what's kind of great about you all is that you do have until 2026. And so hopefully there's something that can be incorporated there.
Thank you.
Don?
Devlin, could you just share any major takeaways from those specialty forums with healthcare community and business community?
Yeah, pulling from kind of what really stood out for me, I will say what one of the individuals that was able to come was a farmer and wanted to make sure that we understood the impact that this had for farm workers and people in the agricultural industry in the state. The other thing that stood out from some of the unions and from the businesses is that their benefits packages are part of the employer package, right? So that's how they get quality employees across the entire country, because they're not just competing within the state. And so really wanted to make sure that the task force understood if we are going to be taking away that part of their negotiation power. For unions, their negotiation power a lot of times is with benefits packages. And so that's covered by universal health care. What else can they use or help with that? And businesses, again, that it is a major part of their budgets. It's part of how they hire and retain employees, and being able to use those.
Are there other questions or comments for Devlin? I don't know if it's helpful maybe to go back to that kind of lessons learned screen, just because that might, yeah, right here, maybe just keep it here. If Colin?
I just reading the remote options first bullet point. I just wanted to echo Grace in that I think that there's a huge need of in-person events as well, but remote events obviously comprehensive. So.
Yeah, absolutely. In 2022, we were still handling a lot of the COVID things that were happening. But there was definitely a lot of talk of wishing we could have done some of that in person. You can definitely get more of a personal connection with people and really understand how this could impact their lives.
Jenny?
I just wanted to ask because I don't think that I know the answer. Were there any of the sessions that were held in person, Devlin? I know you were all in the thick of the pandemic, so I don't remember there to be.
No, they were all virtual. However, I'm wondering, I'll need to go back and look. I think maybe one or two of the initial session roundtables may have been in person, but I'll need to go back and look at that. Yeah, I started just after those roundtables had ended.
Grace?
Hi, I just wanted to say hi, Devlin. My name is Grace. I work on the health equity team with Micah. She's talked that she loves that you
Yeah.
facilitate. So thanks for being here. I had a question about um uh since you understand the landscape of the work, what was something that community uplifted the most that you think may be practical to uplift in this space? Since you've probably heard tons and tons of iterative feedback about what's needed.
Yeah, and I don't think it comes to any surprise to this group, but it was about taxes and the cost. I mean, without fail, every single person was, we want to have this, but we don't want it to be worse than what we already have. You know, people are living paycheck to paycheck and day to day, and I think that came out loud and clear of just we want this to be affordable, um, and if free of, obviously, if they can, we can.
That makes sense. Thank you.
I was reminded that we do have some, if we want to take Devlin's slides down on our other slides, we have some prompt questions to further our discussion. Yeah, here we go. So just to get people thinking a little bit more about what he just presented.
Yeah, I thank you for putting up these questions, and they are not necessarily not easy questions, and I think that's where this group will be able to come in and talk and figure out, especially engaging with the business and healthcare industry. If you look back at some of the old materials, health insurers didn't even want to such an interest forum. They wrote a very clear letter that they were not fully in support of this. However, everyone was in support of making healthcare accessible. So it's understanding where can you find this middle ground, what you all can do to make sure that you're getting community voice and uplifting it where you can. And I'm happy to try and think through that as well. I think it's forever changing and trying to learn.
Jenny?
I just wondered, Devlin, when the groups that were put together specifically for outreach purposes, when they were selected, how were those groups identified as the groups that would have specific outreach? Was it in the legislation, or was that something that was decided upon by the task force or by, you know, the people working for community engagement? And how did you decide who you would do the outreach to? And what were the conversations around who you did not select, which community groups you did not select for specific outreach?
Yeah, absolutely. So I can talk a little bit to this. I don't want to talk for the task force. I wasn't on the task force. I was staff that was helping. But they had a group that focused, similar to you all, on who they wanted to reach out to. I'm not sure how they decided who not to reach out to, but I know some of that also was with the help of Lara Media Services and their connections that they had. And then what was the second part of your question? Sorry.
I think you kind of answered it in one. It was, how did you decide who to reach out? How did they decide who to reach out to? And how did they decide? I mean, I don't know if it was a decision on who not to reach out to, or if they were just the gaps in who couldn't be included because of time constraints or
Yeah, I
outreach
think it
constraints.
was, yeah, time and resources constraints cited a lot of those for us, I believe.
And I just want to let the group know on bullet 2, one of our Universal Health Plan board members, Cheryl Ramirez, works in the behavioral health industry. Oh, I'm gonna forget. Jenny or Katie, help remind me of the name of the organization that has a really long name, but it's a association of mental health providers, whose name I cannot think of at the moment, but we do have some representation, at least from the behavioral health provider side. on that. And both Cheryl, myself, and Juan Pablo sit on the Behavioral Health Crisis System Advisory Committee that has a good cross-section of lived experience and system folks. So there might be this intersection with that. I'm getting thoughts.
Amy, it's
Mhm.
the Association of Oregon Community Mental Health Programs.
Thank you.
And I'll also let everyone know that during the last board meeting, there was some conversation around future meeting topics for the board to have presentations on. And one of the requests was for the board to hear a presentation on behavioral health. And the board also stressed that both on behavioral health and on long-term services and supports, which is another topic they wanted more engagement on in a presentation, was that whomever come to speak in whatever presentation was given, that it was really given from the perspective of not just what is the current state of affairs, but really looking forward to what would it look like to integrate behavioral health into the universal health plan? What would be the necessary supports there? What would be the services? And so that probably won't be until sometime in the new year, but that is something that the board is also going to have a presentation on in the future for your information.
Yeah, and on the long-term care piece, I'm not sure if folks on this committee know, and Devlin, or you can correct my language, but I know long-term care was something that the task force kind of left for us to struggle through, for lack of a better word, but kind of set aside because it is such a large thing financially, and the number of people it impacts and all of that. So that is going to be part of our work, and why we are going to have a focused presentation on long-term care. And one of the things that I asked for was us really, as we do that, having common understanding of what we mean when we say long-term care, because there's, you know, long-term care in terms of what we think of most traditionally, like with our elders. But then I have a, you know, a developmentally disabled child that's in the DDS system, and there's long-term care happening in community across the lifespan. And so as we talk through that, we'll need to be really specific about what we mean and making sure we have the same meaning. Michelle?
Thanks for reminding us all of that, those two ways that shows up in healthcare in Oregon. That does make me think about, on this question of gaps in outreach to be addressed. It sounds, Devlin, like one of the groups that, with your limited time and resources during a global pandemic, that you wish that there could have been deeper or broader reach within disability communities in Oregon. And I'm wondering specifically about developmental disability as a focus, especially to tease out some of those differences. So that was one thought. And the other thought, when we start looking at this other question, what are the existing structures and meetings that we can use to engage? I'm wondering what you all know about in terms of, like, what are those tables, whether they're industry specific, region specific. I'm thinking about the Oregon Public Health Association as one example. And I know I can't think of the acronym right now, but I know there's an association of many of the coordinated care organizations in Oregon where they
CCO Oregon.
Well, there's CCO Oregon, and I think there's one other one.
Mm-hmm.
But yeah, both of those tables. So just curious, like, what you all think as we start moving into some brainstorming, like, what do you know about in your region or in industries that you have touch points in?
That was an invitation for committee members to bring forward, is that right? Like,
thank you, Amy. Yes.
Okay, I just wanted to make sure. And again, this is something we'll continue to talk about, so I saw Grace come off.
Of course, yeah, I would love to step forward. I would say that this question is very important and also for me requires a little bit of thought because I can name so many, but not off the top of my head. So it would be nice if we had like a collective document of some type because I would absolutely love to just list and go through all of the organizations that I've been in touch with. And there's tons. There's Ortrel, Community of Local Health Officials. OPHA has also helped to uplift House Bill 4052, which I work on for the health equity team. So they created House Bill 4052 that declares racism as a public health crisis. There's also the Oregon Advocacy Commission's office with, they have outreach to the Commission of Hispanic Affairs, Commission for Women, Commission for Black Affairs, and Commission for Asian Pacific Islanders, one of which we have here, Mickey. Thank you so much for being on the commission. But I would totally love to create that list, and maybe if there's a collective list that we can have, I would absolutely love to contribute. And I think it would be an easy copy and paste kind of situation.
I think Jay, Colin, and then Mickey.
Yeah, I just wanted to agree with Grace on that. There's a lot of different like associations and agencies that do this type of work anyways. But I did want to request that if we do this type of list, can we make sure that it's specific to regions as well, just so like we're not double working? I know sometimes there's the same agency that's overseeing like Layton County that's also working in like Portland, right? So just like trying to narrow it down so we're not double working or double adding like more information than needed. So
Colin?
I think there's a difference perhaps between encouraging a business to engage like fully in the whole process and also just the informing of like just the existence of this group. I was one of the people who wrote that. I just wrote that 3-page long letter, which was the testimony that was emailed out earlier. And I think part of the crux of that is like, even though Jensina, I think you mentioned that there's a lot of people in Oregon that are watching this group, I think there's a larger amount of Oregonians that have no idea this thing is happening and exists. So.
Good point. And Mickey?
Hi there. So in terms of gaps, I also, because I work with homelessness, I also thought about maybe including homelessness population community members, especially since it's one of the top 3 priorities of the governor is housing, homelessness, the second being behavioral health and homeless folks. There's a high rate of people impacted by behavioral health issues. So that's one gap. And then the other thing I wanted to share was about the existing structures and meetings that we could use to engage with these groups. What we usually do, or what I've experienced, is that we usually create a meeting. We might be doing it online or in person, but one of the things that I've done in the past, this was regarding emergency management, disaster preparedness. We actually went to where people were, and they already had a meeting in place. Instead of them going to us and us creating a date and time, and hopefully it works for everybody, we went to people and they already had the meetings. Their regular meetings might be once a month. Like, for example, Grace was sharing the Oregon Advocacy Commission. We have the Black Affairs, the Hispanic Affairs, the Asian Pacific Islander Affairs, and they already have meetings scheduled. So adding us to their agenda so that we're meeting them where they're at, and we could be sure that they're being reached as well. So that's one idea. Thank you.
And Jay?
Yeah, I just wanted to clarify that question. When it's saying gaps to be addressed, are we answering some of those gaps that we're seeing on our end? Okay, perfect. So one of the things that I think is a huge gap just within the systems of Oregon is those that are recently released from incarceration. There is a very, very limited access to any type of supports or services, including healthcare. Another one is just being more culturally specific. I do see that there is not a lot of agency providers who are like providing the supports to a specific demographic that are deemed safe. So it's really hard to access anything if just me as a Black woman, I'm not going to go to someone that I know is not Black friendly. So that's a big gap, is just knowing like where is safe to go and have those conversations. And then lastly, youth that are emancipated and are not of the age of 18 yet. There's a lot of youth between the ages of 16 and 18 who do have a voice and should be able to speak up and, you know, provide input to some of the barriers that they're facing. Unfortunately, there's not much outreach to that because they're like requiring them to be over 18 or come with a guardian, and they don't have either. So those are some of the gaps that I see on my end. And then the last thing, I promise, is individuals with intellectual and developmental disabilities. We keep focusing a lot on developmental disabilities, but we're forgetting that intellectual piece as well, and that's very important. Again, a lot of the times they come with their own providers, and there's just like a big gap in understanding and providing like their voices in a matter of where they're able to speak openly about the situation without like being hindered or redirected or cued for something. So that's all. Those are my 4 gaps.
Thank you. Juan Pablo.
Sí, quería compartir un comentario, ya que tocamos el punto de diferentes poblaciones que merecen un poco más de atención. Considero y sugiero que hay una población que se encuentra en reclusión o que está en custodia, que a veces no tiene acceso a servicios de salud mental, como consejería, peer support o algún apoyo que transicione en el proceso de reinserción social. Yo entiendo que no está muy ligado con el área de salud, pero contemplando esta idea, si estas personas no tienen una adaptación de apoyo emocional, eso va a incrementar y ha venido incrementando la reincidencia en diferentes delitos, pero la matriz sigue siendo una necesidad de salud mental. Entonces creo que quizás por allí, complementando el comentario de Jay, pudiésemos tener un balance más amplio.
Thank you. And then I put my hand in the queue also just to follow up on Jay's comment about the intellectual community with intellectual disability and developmental disability. And the Oregon Self-Advocacy Coalition is one group that comes to mind that I've engaged with and gone to their events because they are some KIC ASS advocates, self-advocates, and yeah, and I think that's a great group to engage with, as well as the Oregon Council for Developmental Disability has new leadership, and I've engaged with him as well, and he is kind of crossed over into some housing work as well. So just to kind of add to our list in the minutes, our brainstorm list. Jay, did you have more?
I was just thinking them. That's what's so funny when you said that. Also, Aura, you know, they're not given enough flowers that they need. Aura is, they just recently did, well, I'm going to use that word, recently did 2457, HB 2457. So Aura is a very big advocate for individuals with developmental disabilities. So definitely want to make sure that they're put on the list. If you want to see some really strong advocates, that's your people.
And when I have reached out to folks at OSAC, it's important that we will need to be very, very thoughtful about supports way beyond plain language, but just in supports and getting feedback and making it very accessible. And as we dig in more, we can go more into that. And I have tried to reach out to Disability Rights Oregon also just to pay attention to this work. And I will continue to do that as well. I haven't been able to get their attention yet, just because I know that they are continually fighting fires for people's civil rights. Grace?
Thank you. I just wanted to respond to a comment that Juan Pablo said. I really wanted to second what you had to say in terms of incarcerated individuals and receiving healthcare access. I know that there's a lot of issues that folks who are justice involved face when getting out of the prison system and going on to an Oregon Health Plan coverage. So I know that is something big that really needs to be uplifted, and I just wanted to second that. So thank you for recognizing that. And separately, for gaps to be addressed, I believe there's not a lot of language access within public meetings, especially for small agencies and businesses and community-based organizations. So providing accessible language materials to community-based organizations who have built community trust, I think, is an important aspect of being able to give materials directly to folks who are will be impacted. And then also a gap to be addressed is, at least from the work that I've done, is using disaggregated data to guide the work. I know that sometimes using disaggregated data, there isn't much data collection, especially as it pertains to breaking up racial categories. But I do believe that using data that is in reports and not duplicating the work is an important part of guiding some of the gaps to be addressed. And then lastly is, how do we encourage these groups to participate? And I think this is just for me. What I've learned from project management is that you have to let people know the role that they play and why. So giving context to the before and after, so that when that information is collected, they understand that they were a part of the relay race, and this is something that is actually meaningful and going to be used. And I think that's just my project management perspective, making people feel like their actions are going to be used somewhere rather than just collected and put on a shelf. So having material that's meaningful to give feedback on is a great way to guide those types of conversations.
Thanks, Grace. John?
Also wanted to chime in to second a prior comment from Mickey. I think Mickey really kind of drilled in a couple of minutes ago on the importance of leveraging existing structures, meetings, and organizations, kind of calling that out. And I think, Michelle, that was the one of the premise of your kind of discussion prompts for us, was to kind of think about leveraging those existing things. But one thing that also stuck out to me, and we haven't really talked about it yet as a group, but Devlin, you called this out at the end of your presentation in terms of gaps and in terms of older adults not seeing enough older adults that you would have liked to have seen more. And so specifically, that is another population, I think, especially because they tend to consume a disproportionate share of healthcare here in our state and in every state, frankly. If we could kind of take that idea, leverage that concept that Michelle introduced and Mickey referenced in terms of leverage existing, meeting those consumers where they are, and instead of asking them to show up from wherever they happen to live, it is that we go to them with this information, and hopefully by doing so, we can get greater visibility among that yet another essential population, that is older adults.
Great. And that reminds me, my colleague is about to participate in Age Plus's policy advocacy kind of group for older adults, that kind of a training series that they're about to kick off. So that's a good place to plug in as well. Any other questions or comments before we move? And this is just getting us kind of flowing with the brainstorming and starting this process, definitely not the end.
I just wanted to, I found the acronym of the other healthcare group that I was thinking of. It's COHO, Coalition for a Healthy Oregon. That's another industry group for coordinated care organizations in addition to CCO Oregon. So wanted to add that to the list.
Are we ready to move to the next slide?
Great. So I would say this is all part of our iterative process. We're on the next slide, but if things come to mind from the previous slide, feel free to add those as well as we wrap up our meeting with our discussions before we go to public comment. So thinking a little bit about generating public interest and feedback, here are some of the questions that we were hoping to get folks started on. And like Amy said, this is the beginning. This isn't your only opportunity. If you're someone that takes time to process, you have these slides, and their staff is happy to take any ideas that you have after this. Because of public meeting law, we can't send out like a Google Doc, unfortunately. But the email address that you all have been using, and I'll get to you in just a second, Juan Pablo. The email address you all have been using to communicate with Katie and Jenny is UHPGB, which stands for Universal Health Plan Governance Board, .info@dcbs.oregon.gov. So that email address you've been using is where you can send any ideas that come to mind at 3 a.m. or next week or in a month. No one will be checking it at 3 a.m., hopefully. But yeah, feel free to brainstorm and process and send those along as they come to mind. And thank you, Jenny and Katie, for compiling those lists. Juan Pablo.
Estoy un poco confundido. Exactamente en este punto, ¿quieren que nosotros generemos un comentario con una idea o sencillamente una información que a través de este correo podemos facilitar algunos comentarios de este tipo para generar interacción con la población? O estoy un poco disperso? Lamento la confusión.
Thank you for asking that clarifying question, and I apologize for the confusion. So what I was saying was, if you think of other groups we should reach out to, email those groups to the staff email to be added to the list. So if you think of another organization or group that we should reach out to for our public engagement after this meeting, you can email it to that email address.
And this is to create the plan that we will be working from. So not to immediately engage with next week, but we're kind of collecting ideas and brainstorming right now for what will go into the plan that we'll be creating as a committee.
And that's separate from, I mentioned that we were wrapping up our discussion and then we'll go to public comment on that's our last agenda item. So I think that's where I communicated in a way that was confusing. So public comment is the last agenda item, and that's where members of the public can share their thoughts with us. So those were two separate ideas. Does that answer your question? Okay. Craig.
Thank you. Can we just pretend we have pretend we have a question we think we want to ask the staff? Can we use that same email, the UHPGB.info@dcbs.oregon.gov? I was just thinking, off the top, pretend one of us has a question, such and such. Was that monitored by the people, the staff? Anyway, thank you.
Go ahead, Jenny.
Yes, Craig, you can always use that email if you have questions about committee, if you are having any sort of issue with like not being able to attend a committee or do something related to the committee. You can send questions to us, comments to us. In what Michelle is talking about, you can send, Grace had mentioned that she probably has a whole list that she could just copy and paste that and send it to staff. We'll collate all that information and bring it back to the committee for all of you. And if you have general questions about, committee administration, you can send that to us as well.
Thank you, Jenny. And thanks for that question, Craig. Before I get to you, Jensina, I just want to go back and check when Pablo, did you have another comment?
No, al contrario, no tengo ninguna pregunta, solo que a veces la traducción, mirar la pantalla, crea un poquito de confusión, pero todo va bien, todo va perfecto. Gracias.
That makes sense. And also, I'm recognizing that the translation takes a minute. So I had asked if that answered your question, and I think I didn't wait long enough for that my question to be translated. So apologies. Great. So Jensina, go ahead.
I'm curious about outreach to detractors. And I know we've talked a lot about making sure that the underrepresented communities are included in this. I'm also curious though about folks that are possibly that could be considered maybe overinsured. Folks who are actually very happy with their current health plan. I'm not one of them, but I'm guessing that there might be some. And I would love to know feedback from them as well.
That's a great question. And I think within the scope of who we are mandated to engage with by Senate Bill 1089, I expect that there will be a lot of perspectives that are skeptical and or opposed to this project, right? Among insurers, among some sectors of employers, business, perhaps, based on some of the engagement and feedback from the task force. So I think if there are specific places that you think we should be engaged, like we do not want to avoid talking to people who have those perspectives. Absolutely. Thank you for calling that out. And so that should definitely be part of our list. Not trying to cherry pick places that we think will be supportive, but really like what are the perspectives we need to hear so that we don't have blind spots, so we understand the concerns and why people are skeptical or opposed. So yes, that is absolutely part of our work as we see it and as the board sees it. And so I welcome any ideas that folks might have about where and how to engage to get those perspectives.
I was thinking specifically of unions, simply because they are such a large group and many of them have already negotiated much better coverage for their members than a lot of us individuals have. And so I could see it coming up that maybe rolling out this universal health plan could undermine some of their negotiating power, some of their bargaining like power, again, to use the word. So that was just where I was going with that thought.
Yeah, thank you for that. Other groups, other ideas, and then also thinking about, some of these questions as well. And we're throwing a lot at everyone. We're basically outlining all of the inputs that we're hoping to brainstorm together to form this plan, as Amy said earlier. So, these questions here as well can be emailed to that same email address if you have thoughts later. Go ahead, Colin.
Yeah, to respond to Jensina about different organizations that may or may not be opposed to this idea. HCAO, Healthcare for All Oregon, the nonprofit that I spend time with, we have a list of member organizations that are already aligned with the general idea of a universal healthcare transition. And I knew that there was at least one union, and I just got it up to double check that SEIU, for example, is aligned with our goals of universal healthcare. So there are unions that are not opposed.
Great, thank you for that. And I believe we have someone here today who comes with some of that expertise. So glad to have SEIU at the table. So we have just a few minutes left. Keep these ideas coming, but also thinking about, are there some kind of bigger picture things that's coming to mind as we have this discussion about, how we can encourage interaction with the board? I heard earlier, go to where people are already gathering. That's a great principle of community engagement. But any other ideas about like how we approach this work? Go ahead, Grace.
Sorry, excuse me if I'm talking too much, but I do have a lot of ideas. And I think in terms of answering these questions, I know you said that we can't have any Google Docs or anything like that because of public meeting law. I've been through the runaround with that as well, and I would highly suggest that we do have some type of collective area where we all have accessible links and PDFs, and I would suggest something like Trello, which means there's different boards, so you can have different community boards, and if we have one assigned to us, then we would be able to generate something collaboratively, rather than, the staff collecting information and then talking at the next meeting, though that would work as well. But I just really wanted to strongly suggest that, and I feel like since it is a long-term project, it'd be nice to have a visual view of the work ahead and how we can do this together, the process together.
Thank you, Grace. And I don't know what is allowed and is not allowed, so we may have to consult with staff and maybe others, legal, I'm not sure, and get back to you, but thank you for that. And I just made a note to follow up.
And I can just give just one point for insight is that similarly, our commissions are not allowed to use Google Docs, but for the purpose of public engagement, you're able to speak with some of the IT and security folks if it's for the purpose of public engagement and accessibility. So as long as you're able to be transparent and there's no private information stored on there, then they allow certain exceptions, but obviously it's on a case-by-case basis. But I just wanted to offer that.
Appreciate that experience. Thanks for sharing that. And then just, I think you all probably know, but for a reminder and also for any members of the public that may be listening, we do have a Universal Health Plan Governance Board website, and our committee has a page. And so all the PDFs in English and in Spanish, the slides, the agenda, all of the meeting materials are available and will be available moving forward on that page as just a starting point to access basic documents, and then we'll explore this this idea as well. So thank you. Other thoughts as we wrap up this brainstorm about how to outreach, who to outreach to, where folks might already be gathering. And if there isn't more feedback now, please do email any thoughts that come to mind later to that staff email. And I will pass it back to you, Amy, to open up the next agenda item. Thanks, everyone.
Hi, so yeah, I think is it okay, staff, for us to start public comment a little bit early? Okay, I'll make sure we're following all the rules. I think we have 2 people providing public comment, and we have 2 minutes each. And so Colin Stackhouse, who's on our committee, had submitted public comment and I think sent it out, and then Tom Sensick. So we'll start with Colin. Are you wanting to share?
Yeah. Yes,
Okay.
please. Yeah, I'll start a 2-minute timer so I don't go over. Pablo, I think the Spanish translation will come soon, so sorry that you can't read the full copy of my letter, but it's a 3-page letter that I think I wrote really thinking of all these overlapping circles of frustration that I'm feeling. One, after listening to the governance board, it seems like email is not an option for us to interact, or at least you guys cannot use email to interact. I'm curious, I hope there's time for discussion about if we can use email to interact, or if we just email less than 7 of us at a time, we're less than a quorum, something like that. So that was one thing. So I do hope that we get some clarity on how we can better communicate with each other. I think that the next chunk of time is going to be all about holding a bunch of different truths kind of together at the same time. And so this conference, the State of Reform Conference, truly it's like the best conference in Oregon to, I think, that I've found to like learn, to collaborate, and to network. And so that's true. And for me, it's true that I don't understand how Amy and Michelle, you guys are not keynote speakers at this conference. Blows my mind that right now you guys are not centered, because this is the center of the conversation about healthcare reform. So then this leads into what we can do as individuals. I was feeling perhaps impotent with like the possibilities ahead if we can ever email. And so I reserved a conference room at the Hilton during State of Reform. And I've told the Hilton that I'm down to stream the governance board meeting on November 21st in the morning from 9 to noon. It seems a little subversive. It seems a little unnecessary. And also outreach is really important. So should we do that? Thanks.
And Tom.
Wow. Well, thank you very much. My name is Tom Sensik. For those that don't know me, I'm a retired family nurse practitioner. I have worked in all of the spaces or the communities you've talked about in my career as a nurse practitioner. I was listening to you. I thank you for your service. I was totally inspired by this conversation. I have been there from the creation of 770 to the SB 1089 to the constitutional amendment. And I was there when it was, as Devlin said, we were limited by time and resources in the creation of which committees could be outreach to. That is my background. I'm a community health nurse, basically at heart. Just a few things. Maybe going back, just know that this will eventually go through a legislative process, right? Where there'll be more community and conversation and all that stuff. So the work you're doing, which is to listen to community and bring forth the ideas of community, while at the same time trying to inform community about decisions that are being made, is so critical in everything that you're doing. Somebody mentioned to look at the HCO website for all the list of all the unions that are supporting this work, all the small businesses that are supporting this work. There's a long, long list. I will add this, that there are provider associations, there are providers associations, physicians, nurse practitioners, nurse midwives, coming on board with supporting the idea that we've got to transform this inequitable system. You are at the space of delivering equity, affordability, and access, and our constitutional right to healthcare in this state. Nobody else is doing that. This is the group that is going to be bringing that forward. So I think, see if there was anything else in my little notes here. Oh, the issue of ERISA. There is somebody that knows ERISA, the ERISA expert on one of the other committees, comes from the DC or Virginia area, was willing to serve on these committees. I've been involved with helping create this board, encouraging people to come to these committees. And the issue came up about insurers. While the insurers are certainly invited to have input, this is about community and affordability and access. And we know that the insurers are largely in the way of that. So accommodating the insurers is not the, well, hearing what they've got to say, and maybe the people that they employ, right? And that workforce thing that you talk about is going to be really important. But I think that's it. And I like the idea of go to the people, don't wait for the people to come to you. So thank you very, very much. Oh, and sorry, look, and please read my testimony both to the board and to your committee. Thank you.
Thank you both for your public comment. I really appreciate the fact that members of the public would take the time to attend and to share thoughts. And thanks, Colin, for doubling up. I appreciate it. I don't have the deep expertise. I'm wondering if staff has any comments. I think that the question you raised, Colin, about clarification regarding public meeting law and emails on the committee is a really good question. And I would invite any staff that is able to provide some comments on that.
I can jump in, Michelle. So during the last board meeting, there was a lot of board conversation about public meeting law, and the board's attorney from DOJ came and gave some additional advice and interpretation to the board about public meeting law.
in the next board meeting, the board will again have a conversation about public meeting law and will likely go into an executive session to get additional advice from DOJ about public meetings law. Essentially, the crux of the issue is regarding updated public meeting law that happened in the 2023 session that talked about serial communications creating a quorum. And that means that, so you can't have a discussion of a group of board or committee, any public body members in which all of them, or I'm sorry, in which you have enough to make quorum and it's not a notice public meeting. What the additional information provided in 2023 was that if you have sequential interactions among public body members, so not me, Amy emails Michelle, Michelle emails another board member, and so on until the same issue is discussed over enough members to make quorum, that constitutes a public meeting. And so it's serialized communications. And so to avoid any possibility of an unintended quorum of the board or an unintended public meeting, what we've done is that we ask all members to send their information to staff. Staff then collates that information and then provides it to the entire committee or to the entire board in a public meeting. And so one of the additional things that the law did was create a personal liability in those situations where there is unintended or unnoticed quorum. For more information about that, you can listen to the board meeting, you can look at the Public Ethics Commission, but we're really going with the most, at this point, the board's policies and procedures are really the strictest interpretation of that law. And all committee members are also subject to the board's policies and procedures. If the board makes a decision to change those policies and procedures in any way that would change how members could interact, then that would also apply to committee members. But at this point, it is recommended in the board's policies and procedures that committee members or board members do not interact with one another or have conversations, particularly conversations that could be considered deliberation, outside of board meetings or committee meetings. So can you email each other? Probably. Is there the potential for there to be an unnoticed meeting? There is. And so to really ensure the safety of the board and as much public transparency as possible, we ask that any committee members who have questions or input or want to have a discussion about something at a committee meeting, email the staff with that information, with those questions, and we will collate that and provide all of that back to the committee. And we really are striving within our meetings to provide enough time for good committee conversation and dialogue during the meeting. And I hope that answers the question enough for people to understand sort of what the issue is and how to move forward. More
I see Juan's hand up.
Go ahead, Juan. I'm sorry. I think I muted myself before I said your name.
Sí, sé que estamos sobre el tiempo, quiero ser muy breve. ¿Cómo le gustaría a este comité que manejáramos expresarle a nuestras comunidades que somos parte de este comité con la importancia que tiene? ¿Quieren que expresemos esto a nuestras comunidades o quieren que reservemos esa información a medida que vayamos progresando y consolidándonos un poco más como estructura?
You can absolutely communicate with all of your community members. It's only members of the public body, so of this committee and of the board. So any public body.
Hey, Jennifer, the transfer. Okay. Okay, thank you for the clarification, Jennifer. Thank you.
There any other questions or comments before we wrap up? And then I don't know, staff, if you want to just kind of prime us for what we're doing next month and such. I see Jensina and then Colin.
I think Colin brings up a good point though, because a lot of the work that gets done on committees is in between meetings. So, and a lot of the brainstorming and productive collaborative efforts that don't necessarily qualify as a meeting or as a serial communication can be very productive. So my question would be, how can we actually contact each other? Since we meet in Zoom, we're not meeting in person, we can't exchange business cards. For example, Jay's here in Eugene. At some point, I'm sure I'll run into Jay. I believe Colin and I probably have some synergy somewhere along the line. How do we reach out to other committee members?
So I'm going to attempt to answer this question, but I want to do it with the caveat that I'm not the board's counsel, and this really is based on legal interpretation and advice coming to the board from the Department of Justice and their attorney there. And so in the last board meeting, the question was asked, can one board member call another? Absolutely. One board member could call another. Could one committee member call another committee member or email another committee member? Yes, they can. There is the possibility, and I think this was also referenced in the public comment that Colin gave, what Jake had said at the time, who is the DOJ attorney, is that there's no controlling that conversation once you've started it. And what he meant by that was not the content of the conversation, but you can't know if you contact one committee member, if that committee member is then going to contact an additional committee member and have that same conversation. And then that committee contact another committee member and have that conversation to the point where you've contacted enough committee members or enough in that chain to produce a quorum. And that's really the crux of the issue that the board is dealing with at this point in terms of looking at its policies and procedures and understanding the advice coming from DOJ and the law as it stands and is interpreted by the Oregon Ethics Commission. Staff is producing a one-pager that will give an outline of the law to the board at the next board meeting. And the board is going to take up the issue again and have a conversation about it. I personally hesitate to sort of give scenario advice beyond that, because as I said, I'm not counsel for the board, and the Ethics Commission is really the interpreter of the law and the interpreter of those scenarios. And so the way that the board has gone about it to this point and how it's written into their policies and procedures is that instead of potentially putting members in the way of liability, they have recommended in their policies and procedures that they not contact each other outside of board meetings. But as I said, and as was said by counsel in that meeting, can one board member contact another? Absolutely. But at that point, that board member is essential, or committee member is taking on the risk that that member could contact another and another until there's a serial quorum reached. And then there would be a violation of public meetings law. And, you know, we like to highlight that really it's about transparency. It's ensuring that the public is privy to all of the information and deliberations of the boards and committees. But like I said, I'm not the right person to get to sort of answer scenario questions. And I think when the board takes it up again in November, we might have
more information and more clarification on how we want to act, how the board wants to act going forward, and how they're going to allow committees to act moving forward, also through their policies and procedures. Colin?
I would like to put in a request, or however I can email, about the opportunity we have on November 21st to offer that additional like conference live stream of the governance board. On the 20th, we'll have the opportunity to maybe put that to a vote. I need guidance as to whether that's the right course of action. So I hope that we can talk about it on November 20th before the 21st.
I can add that as an agenda item, and I can talk to the chairs.
Craig?
Thank you. Mine's just a comment. All the years I've done these Zoom meetings, I've never done this before. I just want to compliment the translator. I thought he did an excellent job, so I could understand Juan Pablo's questions. I just wanted to point that out. Thank you. Thank you.
Okay, we have just a few minutes left, and I do want to let everyone know that for the next meeting, first of all, please send us all of the thoughts that you have in terms of different organizations, entities, existing resources that we should be reaching out to, or that we should have conversations about whether or not we'd like to reach out to. Also, the Oregon Advocacy Commission and Grace, one of our committee members, is actually going to be giving a presentation to the board during the next board meeting on November 20th, November 11th. Our next meeting is November 11th. Sorry. Is that right? I don't have my note. I'm sorry. But during that meeting, the Oregon Advocacy Commission will be giving a presentation on the outreach they did around racism as a public health crisis, and giving us some information about how they conducted that outreach and what they learned from the community. So that's going to be exciting. If there are other topics or interests that you think we should be adding to future agendas, please feel free to email those to me, and I will have conversations with the co-chairs about how to structure our coming meetings.
Thank you, everyone. It was really great to get to know all of you a little bit better, and we're really excited to kick off this work and continue working with you.
Yes, thanks so much, everyone. I really appreciate all the engagement, the great ideas that were brought to this meeting, and just the collaborative nature of this first discussion. So looking forward to lots more. Thanks so much.
Thank you.
Happy Halloween, everybody.
Thank you.